Our emotions are powerful forces that shape our experiences. We feel joy, sadness, anger, and fear in response to life's events. But what if these emotions had a more profound impact on our well-being than we realize? What if they held the key to not only understanding but also influencing our physical health? The field of psychosomatics explores this intricate connection between the mind and body. It delves into how our thoughts, beliefs, and emotions can influence our physical health. This connection is not a one-way street. Our physical state can also impact our mental and emotional well-being. Consider the gut-brain axis, a complex network linking our digestive system and brain. An imbalance in gut bacteria can lead to anxiety and depression, highlighting the interconnectedness of our physical and mental states. This understanding forms the bedrock of many holistic healing approaches. It emphasizes the importance of addressing the whole person, mind, body, and spirit for true and lasting healing. The idea that our emotions can influence our health is not new. Traditional healing practices worldwide have long recognized this connection. Ancient systems like traditional Chinese medicine and Ayurveda have for centuries viewed illness as a disharmony between mind, body, and environment. These practices emphasize restoring balance to achieve optimal health and well-being. While modern medicine has made incredible strides in treating disease, it often focuses on addressing symptoms rather than root causes. This is where alternative approaches like German New Medicine or GNM offer a different perspective. Developed by Dr. Gerd Hamer, GNM posits that diseases, including brain cancer, are not random occurrences but meaningful biological programs initiated by unexpected emotional distress. Hamer, a former internist, developed this theory after experiencing a series of personal tragedies, including the death of his son. He observed patterns in his patients and himself, suggesting a link between specific emotional conflicts and the development of particular diseases. While controversial and not widely accepted by the medical community, GNM provides a thought-provoking framework for understanding the mind-body connection, particularly concerning serious illnesses like brain cancer. GNM challenges conventional medical thinking by suggesting that disease is not the enemy, but a significant biological program initiated by the brain to help us cope with unexpected emotional distress. According to GNM, when we experience a sudden, unexpected, and unresolved emotional conflict, our brain triggers a cascade of biological responses, including changes in specific organs and tissues. These changes, often perceived as disease symptoms, are the body's attempt to cope with the emotional conflict and ultimately resolve it. GNM is based on 5 fundamental principles, known as the 5 biological laws, which explain the body's response to emotional conflict. These laws provide a framework for understanding the development and progression of disease based on the specific type of conflict experienced. The first law, the Iron Rule, states that every disease originates from a DHS, a Dirk-Hamer syndrome, named after his late son. This DHS is characterized by a sudden, unexpected, and highly stressful event that catches us off guard. The second law, the law of 2 phases, describes how the body attempts to resolve the conflict. The first phase is characterized by stress, cold extremities, loss of appetite, and sleep disturbances. If the conflict is resolved, the body enters a healing phase, often accompanied by fatigue, inflammation, and pain. The third law, the ontogenetic system of tumors and cancer-equivalent diseases, links specific brain areas to particular organs and tissues, suggesting that the location of the conflict in the brain determines the location of the disease in the body. The fourth law, the ontogenetically determined system of microbes, explains the role of microbes in the healing phase. According to GNM, microbes are not the cause of disease, but rather work symbiotically with the body to restore balance. GNM offers a radical perspective on brain cancer, suggesting that it is not a random cellular malfunction, but a meaningful biological program initiated by a specific type of emotional conflict. According to GNM, brain tumors, like all cancers, arise from unresolved emotional distress. The specific location and type of brain tumor correlate to the nature of the conflict experienced. For instance, GNM associates glioblastoma multiforme, an aggressive type of brain cancer, with a conflict of feeling unable to protect or care for someone in one's territory. This conflict triggers cell proliferation in the brain area, responsible for controlling the perceived threat, leading to tumor growth. While this perspective challenges conventional medical understanding, it encourages us to explore the emotional and psychological factors contributing to disease development. It is crucial to emphasize that GNM's views on brain cancer and other diseases are highly controversial and not supported by mainstream scientific evidence. The medical community generally does not accept GNM, and it is essential to approach these ideas with a critical and discerning mind. However, GNM's perspective, while unconventional, highlights the potential influence of our emotional landscape on our physical health. GNM's emphasis on the role of conflict and trauma in disease development aligns with growing research in the field of psychoneuroimmunology, or PNI. PNI explores the intricate relationship between the nervous system, the immune system, and our psychological state. Studies have shown that chronic stress, trauma, and unresolved emotional conflicts can suppress the immune system, making us more susceptible to illness. For instance, research has linked early childhood trauma to an increased risk of developing chronic diseases later in life, including cardiovascular disease, autoimmune disorders, and even cancer. This research suggests that our experiences, particularly those that generate significant emotional distress, can have long-lasting impacts on our physical health. GNM takes this concept a step further, proposing specific correlations between the nature of the conflict and the type of disease that develops. While GNM's specific correlations require further investigation, the underlying principle that unresolved emotional distress can contribute to disease development is gaining traction in both conventional and alternative medicine. This understanding highlights the importance of addressing not only the physical symptoms of disease, but also the emotional and psychological factors that may be contributing to its development. Central to GNM is the belief in the body's innate intelligence and its inherent capacity for self-healing. GNM views disease as a meaningful biological program initiated by the brain to help us cope with and ultimately resolve unexpected emotional distress. The symptoms we experience are not malfunctions, but rather the body's attempt to adapt and heal. GNM suggests that true healing involves identifying and resolving the underlying emotional conflict, allowing the body to return to a state of balance and well-being. This perspective empowers individuals to take an active role in their healing journey by exploring the emotional roots of their disease and seeking therapies that address both the physical and psychological aspects of their condition. While GNM's approach to healing is not a replacement for conventional medical treatment, it offers a valuable complementary perspective. By addressing the emotional and psychological components of disease, individuals may enhance their body's natural healing capacity and improve their overall well-being alongside conventional medical care. While GNM and conventional medicine may seem at odds, there is potential for integration and collaboration. GNM's focus on the mind-body connection and the role of emotions in health can complement conventional medicine's emphasis on diagnosing and treating physical symptoms. By combining the strengths of both approaches, healthcare providers can offer a more holistic and comprehensive approach to patient care. For instance, integrating GNM principles into oncology care could involve incorporating psychotherapy, stress reduction techniques, and emotional support alongside traditional cancer treatments. This integrative approach could potentially improve patients' quality of life, enhance their coping mechanisms, and address the emotional and psychological aspects of their illness. While more research is needed to validate GNM's claims and establish its efficacy, its focus on the mind-body connection and the potential impact of emotions on health aligns with growing trends in integrative medicine. By remaining open to exploring new perspectives and fostering collaboration between different healing modalities, we can strive to provide the most comprehensive and effective care for patients. GNM's controversial nature often sparks debate and skepticism, challenging conventional medical thinking and prompting us to question our understanding of health and disease. While skepticism is crucial, it is equally important to approach new ideas with curiosity and openness, recognizing that our understanding of the human body and its intricate workings is constantly evolving. GNM's perspective, while requiring further investigation, serves as a reminder that there is still much we don't know about the complexities of the mind-body connection and the true nature of disease. This realization calls for greater openness and inquiry in healthcare, encouraging collaboration between different disciplines and a willingness to explore innovative approaches to healing. By fostering a culture of curiosity, collaboration, and a genuine desire to alleviate suffering, we can strive to create a healthcare system that addresses the needs of the whole person, mind, body, and spirit. This holistic approach acknowledges the interconnectedness of our being and recognizes the importance of integrating diverse perspectives to unlock the full potential of healing.